Hi everyone, today I am going to talk about my medical specialty. I am the Dr. Villatoro and I am 30 years old and my medical specialty is a cardiovascular surgeon. With first, I am going to talk to you a little about what is a cardiovascular surgeon. A cardiovascular surgeon is a specialized doctor in performing surgical interventions on the heart and the blood vessels to repair damage caused by disease or disorders of the cardiovascular system. These surgeons perform different types of operations such as the heart repair and replacement, heart defect repair, coronary artery bypass, aneurysm repair, and heart transplant. What is cardiac surgery? Cardiac surgery is any kind of surgical procedure performed on your heart or any related blood vessels near where they connect to the heart. In some cases, these surgeries may involve the tissues or structures immediately next to the heart. And the next question is, what does a cardiac surgeon treat? Cardiac surgeons can treat any disease, condition, or injury that requires surgery to repair or correct. This can include anything for trauma, like from a car crash, stab wound, or gunshot, to correcting heart damage from disease or a condition. Where I work. I currently work in my medical office, which is located at Nuestra Señora de la Paz Hospital. What types of patients do you see? I see patients who have disease or disorders of the cardiovascular system, which includes the heart and the blood vessels. Where did I get my major and how long did it take? I had the great opportunity to study at the National University of El Salvador, and I graduated with a doctorate in medicine, and then I obtained a scholarship at the University of Maryland, which asked me to score 80 points on the TOEFL IBT, and it took me 5 years to be able to obtain my specialization in cardiovascular surgery. What medications do I use? In the first one, we have the aspirin. This one helps to reduce the formation of clots, which facilitates the flow of the blood through the narrowed arteries of the heart. The second one is the nitroglycerin. This one can help the control or relieve chest pain. Nitroglycerin is available in tablet, spray, or patch form. The next one is the beta blockers. These medications make the heart grow more slowly and with less the strain and thus alleviate the pain of the pectoral angina. And the next is the stents. This one helps prevent the fatty deposit known as plaque from the clogging the heart arteries. Instruments and medical equipment I use. In the first one, we have the electrocardiograph. This one, the main function of the electrocardiogram is to evaluate the electrical activity of the heart and provide information about the heart rate, the size and function of the heart chambers and the heart muscles. The second one is the echocardiograms. The function of an echocardiogram is to evaluate the structure and function of the heart using high frequency sound waves ultrasound to create image of the heart and its structures. And the next one, we have the blood pressure monitors. The blood pressure monitors, the main function is to measure and monitor a person's blood pressures. The next one is the Holters. The main function of the Holter is to record and store a patient electrocardiogram for extended period of time, usually for 24 hours or 48 hours, while the patient goes about their normal daily activities. The next one, we have the stethoscope. The main function of the stethoscope is to allow the healthcare professionals to hear the internal sound of the body, especially the sound of the heart and the lungs. And the next one, we have the Doppler. The main function of the Doppler is to measure and evaluate the blood flow in the human body. So now I am going to talk a little about one of my patients. His name is George, who had been diagnosed with heart disease and was following medical treatment to control his condition. And one day, while at a follow-up appointment, George mentioned that he had been experiencing symptoms such as chest pain and shortness of breath during physical activity. So I decided to perform some additional tests to evaluate George's heart condition. And after performing an electrocardiogram and stress test, it was confirmed that George had a blockage in one of his coronary arteries. So I informed him that he needed coronary bypass surgery to improve blood flow to the heart. So George underwent open heart surgery and had a successful recovery, and after surgery he underwent a cardiac rehabilitation program to strengthen his heart and improve physical condition. Over time, George was able to resume his daily activities and enjoy a better quality of life. It has been a pleasure to talk to you a little about my specialty and everything that entails. Thank you very much for your attention.